Hello guys, welcome to today's video. In my last video, I made mention of me being a pharmacist, and I promised that in my next video, I'm going to tell us what the financial lives of pharmacists and health workers are like in Nigeria. That's what we are going to be discussing in today's video. And maybe by the end of this video, you guys will help me in judging this case, in determining if health workers in Nigeria are rich or if they are not rich. So I'm going to be telling us what their salaries are like in Nigeria, because I know that there is actually this notion that some people have that health workers in Nigeria are rich and they have a lot of money, but that's actually not true. Like, a lot of health workers in Nigeria are actually struggling financially. So I will start from pharmacists because I'm a pharmacist. By the way, my name is Blessing, in case you are seeing my face for the first time, and in this channel we discuss many things that I've already stated in my introduction video. So if you have not watched the introduction video, I'll put the link in the description so that when you are done with this video, you can go and check out that introduction as well. So I said I will start with pharmacists because I'm a pharmacist. So in Nigeria, an average pharmacist earns between 150k to 500k. And by 150k to 500k, I mean like 150,000 naira to 500,000 naira. And dollar equivalence should be, let me just say, approximately $150 to $500. Let me just approximate it like that. That is what a pharmacist earns in Nigeria. And this range is actually dependent on the level at which the pharmacist is at, because what a fresh graduate will be earning is actually different from someone who has like gained, let's say, from 2 years experience, 3 years, 5 years, or 10 years experience. So that is what leads to that range, depending on how many years experience that person as a pharmacist has gained. So a fresh pharmacist graduate may start earning from $150 to $250 a month. Then as the pharmacist keeps gaining more experience, it will now keep increasing and increasing, and it can increase to $500 a month depending on where the pharmacist is working, because that is also another factor to put in place, where the person is working. So if the person is working in a good organization, the more years of practice the person gains, the higher the pharmacist's income will become. And this income range applies mostly to those pharmacists that are working in the hospital or those that are working in community pharmacies. By community pharmacies, I mean, those pharmacies out there in the streets or on the road that you can just walk into and then get your medications. Those independent pharmacies that you can see on the road, we refer to them as community pharmacies. So this income range actually applies mostly to people that work either in the hospital or people that work in pharmacies like that, community pharmacies. This salary range can also apply to pharmacists that are working in manufacturing companies, although theirs may be higher depending on the company they are working. Okay, theirs may be slightly higher, but it can also apply to them to some extent. And it can also apply to all those pharmacists that are medical reps, except say those pharmacists that are working for multinational companies, then their own may be much more higher. And just like we know, it's not everybody that may be lucky to get jobs in multinational companies to work for them as their medical reps. So not many pharmacists end up getting those jobs. It's just few pharmacists that will get that privilege to be working with multinational companies, and if that's the case, they are exempted from this range because their salary is usually worth it. So you guys should tell me, if a pharmacist is still struggling to make, let's say, $500 a month after many years of graduation, let's say after 2 years or after 5 years, and some even after 10 years of graduation, still don't get up to $500 a month, do you guys think pharmacists are rich? People should please let me know your thoughts in the comment section. I would really love to know. Okay, I'm saying pharmacists here because I'm a pharmacist. I believe that this also applies to doctors, nurses, physiotherapists, medical lab scientists, and radiographers. But I'm actually saying pharmacists because that's my profession and that's what I'm doing. That's who I am, right? But this also applies to other health workers. And with this salary range and from the way the economy is going, you find out that many health workers cannot even afford to live a decent life. They can't afford a decent lifestyle. Find out that many health workers cannot even afford to, buy a simple car or even live in very beautiful houses, or some people cannot even afford to board a flight when they are traveling long distances. They will still have to follow road transport. So this is actually not encouraging at all, because you find out that the health workers that are able to afford to live a decent lifestyle are either those that have changed career, that is those that have moved from working as a health worker into an entirely different careers, maybe into tech or some other things, or maybe those that are working for big multinational companies, which, as I've mentioned earlier, it's not everybody that will be privileged to get an opportunity to work with those companies, right? It's not everybody that is privileged to work in those big companies. So those are the people that at the end of the day may end up being able to afford to live a decent lifestyle. And that's why you can't even like blame those people that are relocating to other countries to look for greener pastures, because many doctors, pharmacists, in fact many health workers are relocating in their numbers, including my own close friends and colleagues. And you can't blame them, because seriously, practicing in Nigeria can be very discouraging when it comes to the income we are earning and the pay, the salaries. Imagine being a pharmacist or a doctor or a health worker, and then after 5 years of graduation, you are still entering public transport to go to work. It doesn't make sense. To me, at least, it doesn't make sense. You know, because you find out that that's why even some health workers end up doing more than one job. Some people end up doing like 2 or 3 jobs at the same time. And if you even look at it very well, you find out that even the money you are paid for doing more than one job is still not worth it. And at the end of the day, it's still like as if it's even better that you don't even do additional jobs. You just stick to one and then use that time that you have to do additional jobs, just use that time to rest. Because if you check the whole thing at the end of the day, you find out that the money you are getting from doing those additional jobs are not even worth it. So please, you guys should tell me what you think about this issue in the comment section. I would really love to know. And I also want to know what it's like in your own profession, because here I focused on health workers because I'm a health worker and I'm very conversant with the pay and their salaries. That's why I just focused on the health workers. But I don't know what it's like in other professions, if it's the same, if it's better, if it's worse. I really want to know, guys. If health workers are earning on average 150,000 naira to 500,000 naira a month, depending on their number of years of practice, please let me know what it's like in other professions. That's also assuming you are practicing what you studied in school. Like me, I'm a pharmacist and I'm currently practicing what I studied in school. That's why I was also able to know all these things. So if you are practicing what you studied in school, please, you can let us know what the salary ranges are like for people in your profession or in your field, and if it keeps getting better over time. Because I'm even beginning to notice that many people end up not even practicing what they studied in school. Just like I mentioned earlier also in this video, that many health workers are also changing careers. They are not even practicing. Many doctors or pharmacists, nurses are even leaving the profession to go and do an entirely different thing that will fetch them more money. So that's even another story for another day. Maybe in my next video I'll talk about that. We'll talk about that. We'll look into it and see why this is happening, or why people are even leaving their profession, what they studied in school, and then moving into an entirely different thing. But please, if you enjoyed this video, give me a like and subscribe to my channel so that you don't miss out on subsequent videos. Hit the notification bell so that when I post any new video, you'll be notified and you can also watch and enjoy. And if you feel like another person needs to see this video, you can also share it with them so that they can also watch. Thank you so much for watching this video to the end, and I'll see you in my next video. Bye bye.